General treatment protocols. Consider the therapeutic categories for each first aid situation and the herbal medicines you have on hand. The main therapeutic categories for wound care are anti-inflammatories, antimicrobials, antiseptics, anxiolytics, astringents, pain aids, trauma aids, and vulneraries. Wash the wound with warm water, try to remove all the dirt and debris. Use mild pressure or gentle scrubbing if needed. When using tweezers, disinfect them first with rubbing alcohol or heat. Clean the wound thoroughly, removing any extraneous matter that may cause infection or prevent the wound from healing. Gentle pat, dry the wound. Apply firm pressure with a clean cloth or gauze to stop bleeding. Maintain the pressure until the bleeding stops. If the cut is on the hands, arm, feet or legs, elevating it above the heart will slow down the bleeding. Stop excessive bleeding with hemostatic medicines. Give internal pain relieving and trauma herbs if needed. Apply antiseptics to disinfect wounds. Apply strained liquid preparations such as teas, tinctures, and liniments directly onto wounds or on the dressing. Internal antimicrobial and immunostimulating herbs may help against infection and speed recovery. Use anti-inflammatories to decrease inflammation and accelerate recovery. External astringents washes can draw tissues closer and reduce inflammation and bleeding. Apply herbs topically before dressing the wound. Use a disposable razor to shave hairs that may get into the wound or prevent the bandage from sticking. Dress the wound. Herbal preparations can be put on the gauze. Avoid making the dressing too wet as this will impede the healing process. Propolis and conifer resins can help tape or bandages adhere to the skin. They also have antiseptic qualities. Check the dressing and wound regularly for infection and change the dressing as needed. If the wound becomes infected, clean and probe for foreign material and redress it. If infection spreads, especially with the signs of a systematic infection such as swollen lymph nodes, seek assistance. Learn to apply steri strips, butterfly, or other types of bandages. Consider using self-adherent wrapping such as wet wrap to hold bandages in place instead of tape. Tape can be painful to remove, especially if the wound needs to be checked frequently. When wrapping wounds, there is an important balance between the bandage being too tight and too loose. It shouldn't be tight enough to hold the bandage in place against the skin and loose enough for expansion, which may happen with inflammation. Bandaging should configure with the contours of the body.